Welcome to Medicare. In this video, Ron House will help you to understand the basics of Medicare by answering some of your most frequently asked questions.
So who can get Medicare? Well, U.S. citizens and legal residents, you have to be in the country for at least 5 years. Now, it's designed for most people when they turn 65. However, you can get Medicare at a younger age if you become disabled and qualify for Social Security disability benefits. Also, if you're diagnosed with ALS or end-stage renal disease, you can qualify for Medicare A and B. So how do you sign up for it? Well, there's basically two ways. If you are already pulling Social Security benefits, you don't have to do anything because Social Security is going to sign you up automatically. And you should receive your red, white, and blue Medicare card about 3 months before your 65th birthday. Now, a lot of people are putting off taking Social Security benefits until an older age. And for those people, they will need to take action and either go to their Social Security office or they can go online to socialsecurity.gov and sign up online. Now, at this time, due to COVID, many of the Social Security offices are closed, but you can call your local office. Most of those workers are working from their home. So what will original Medicare cost me? Now, Part A, which covers hospitalization, most people do not have to pay a premium for Part A because during your working years, as long as you worked at least 10 years or 40 quarters, you had Medicare taxes taken out of your paycheck. And there is a premium for Part B, however, and that is income adjusted. And what Medicare does is they look back at what you made 2 years previous. So people that are aging into Medicare during 2020, they're going to look back at what you made back in 2018. And if you made less than $174,000 adjusted gross income for a married couple filing jointly, you will pay about $144.60 a month for your Part B premium. Everybody pays a Part B premium. Also, there is a late enrollment penalty that is assessed by Medicare if you do not sign up for Part B when you're supposed to. And for every 12-month period that you're out of the program, Medicare is going to charge you a 10% penalty. And that penalty will never go away. So what are the parts of Medicare? Well, there's 4 parts to Medicare: Part A, Part B, Part C, and Part D. Now, Part A is hospitalization, Part B is medical coverage, and that is known as Original Medicare. So under Part A, that covers inpatient hospitalization, it covers skilled nursing facility care, it also covers hospice care and home care visits. Now under Part B, which is medical insurance, that covers doctors and outpatient services. It also covers preventive care procedures that are covered under Medicare. And it also covers durable medical equipment. So you can, on Original Medicare, there are no networks. You can go to just about any hospital in the country. There are over 6,000 hospitals that accept Medicare, and the majority of doctors in our country do accept Medicare. So when you're on Original Medicare, you have a little bit more flexibility, and you're in control. So when you want to, for instance, see a specialist like a cardiologist, if you're on Original Medicare, you simply call the cardiologist office, ask them if they accept Original Medicare, and you make the appointment. You don't have to get a referral from your primary care doctor. You don't have to wait for an approval from the insurance company if it's an HMO or a PPO. You just go and then Medicare pays the claim. There are no networks. You're not assigned a primary care doctor, and you just have a lot more flexibility. You have a 7-month enrollment period to enroll into Part A and Part B, and the time period is the month you turn 65 3 months before and 3 months after. If you enroll during that period of time, then you will avoid that 10% penalty that's assessed by Medicare. Now, Part C of Medicare is Medicare Advantage, and many people refer to it as private Medicare. So with this option, it includes Part A benefits, Part B benefits, and most of these plans also include Part D, or prescription drug benefits. Now, these plans are offered through private insurance companies. And so when you join a Medicare Advantage plan, you're switching original Medicare A and B for that Part C Medicare Advantage plan. And then Part D is prescription drug benefits. That started back in 2006, and that helps you with your prescription drug coverage. Now, there's two ways you can get Part D coverage. One is standalone Part D plans, and there's approximately 28 plans that are available in the year 2020. Or you can get Part D benefits through your Medicare Advantage plan. Now, a lot of people wonder, why would I need either a Medicare supplement or a Part C Medicare Advantage plan? Well, let's see what original Medicare covers. So here we have Hospital A. What happens to you if you become an inpatient in a hospital? Well, before Medicare pays for anything, you're responsible for the deductible of $1,408. That's in 2020. That'll cover you for up to 60 days. Now, if you have to stay in the hospital past those 60 days, then Medicare starts charging you a daily copay of $352 a day. So a 90-day hospital stay could potentially cost you over $11,900. And hopefully you won't need blood, because the first 3 pints of blood are not covered under original Medicare. Now, after 90 days, if you still need care, then you're allowed to tap into 60 lifetime reserve days. Now, you can only use those once, and once those are gone, you can never use them again. And once you're using those 60 lifetime reserve days, you're going to have a $704 a day copay. And so a 150-day hospital stay could potentially cost you $54,208. And then your hospitalization benefits are exhausted. You would be responsible for 100% of the hospital costs after 150 days. So with original Medicare, there is no out-of-pocket max or cap. Now let's talk about Part B of Medicare. Part B covers doctors and outpatient services, outpatient surgeries. So there is a annual deductible. This year it's $198. And so your first visit to a doctor, specialist, outpatient service, or an outpatient surgery after the first of the year, you're responsible for the first $198. After that's satisfied, Medicare pays 80% of the bill, and then you're responsible for 20% of the bill. And then if you happen to go to a doctor or a medical facility that does not accept Medicare assignment, then you could be subject to an additional 15% charge. And what is Medicare assignment? That's the amount that Medicare pays out, substantially less than the retail rates that medical facilities and doctors charge. So what we're seeing more and more is that more and more surgeries are done on an outpatient basis. And so you could be facing bills of $10, $20, $30, or $40,000 to have an outpatient surgery. So even with Part B of Medicare, there is no out-of-pocket max or cap. So how do you avoid the risk of all of these out-of-pocket expenses that Medicare does not pay? Well, you have 2 options available to you, and I tell people basically there's 2 roads available in Medicare today. So as we look at this following slide, the first thing you have to do is you have to sign up for Part A and Part B of Medicare. Now, if you want that freedom and ability to go to any hospital or see any doctor in the country, then most people will stay on original Medicare. And if they do that, then to avoid those large out-of-pocket expenses, they will usually get a Medicare supplement, also known as a Medigap policy. That's what they were first called back in 1966 when Medicare came out, because there were gaps in coverage, and so private insurance companies came out with these Medigap policies to help pay for the costs that Medicare would not cover. Now, in addition to that, you would probably want to get a standalone Part D prescription drug plan. So as I mentioned earlier, we have about 28 different choices. The prices range anywhere from about $13.20 a month premium all the way up to $84 a month. Now, the other option that you have is to sign up for a Medicare Advantage plan, Part C. Now again, Part C, or Medicare Advantage, includes Part A benefits, Part B benefits, and most plans include the Part D prescription drug benefits. So it's all in one. These are provided by private insurance companies. So when you decide to go with a Medicare Advantage plan, you're swapping original Medicare for that local Medicare Advantage plan. And these companies, they usually have service areas. You have to live in their service area in order to be covered under that plan. Let's cover the first point here under original Medicare. If you decide to stay on original Medicare and you want a Medicare supplement, let's kind of review how these Medicare supplements work. There are 10 standardized plans available, and we're going to show you those in just a few minutes, but that just means that, for instance, a Plan F, there's over 40 different plans available in my state, and that means that every Plan F is exactly the same benefits. The only difference is what that company charges in premium. So most of these Medicare supplement plans are going to pay for that hospital coinsurance if you're in there past 60 days. They're going to pay for things like skilled nursing care. They're going to pay the coinsurance for hospice if you end up on hospice. It'll also pay for an additional 365 days of coverage. Remember what happens if you're in a hospital continuously for 150 days? Then your hospitalization is exhausted. Well, every Medicare supplement plan will cover you for an additional 365 days. They pay 100% of that hospital bill. So many of the plans also pay for things like the hospital deductible, the $1,408 in 2020, the Part B deductible, which is $198. They'll pay for the things such as excess coverage if you happen to go to a doctor that does not accept Medicare assignment. Now, there's many plans that are available, many companies that offer these plans. It's just very important that you select a company that has been in the market for a good number of years and that has a long history of premium stability. Now let's take a look at the different plan designs that are available for Medicare supplements. So on this sheet here, we see that there are currently 10 plans available. And even though I have X'd out Plan C and Plan F, those are grandfathered for anybody that aged into Medicare before January of 2020. They can still buy a Plan F if they want to. But for new beneficiaries, they are not allowed to do that because of legislation that was passed by Congress about 4 years ago. So as you can see, the Plan F has been one of the most popular plans in our country for many, many years. If you had a Plan F with original Medicare, you cannot get more comprehensive coverage than that because you have no cost sharing, you have no out-of-pocket expenses. That Plan F picks up the Part A deductible, the Part B deductible, the coinsurance in the hospital. It pays for the skilled nursing care coinsurance, and it pays the it pays for the excess charges if you happen to go to a doctor that does not accept Medicare assignment. So people today that are aging in 2020, if they want comprehensive coverage, most people are going with the Plan G. Now, as you can see, the only difference between the Plan G and the Plan F is that you would be responsible for the Part B deductible of $198. And again, that's due upon your first visit to a doctor or a specialist after January 1 of each year. Once that's satisfied, you have no further cost sharing. There are no co-pays, no other cost sharing at all. So again, very comprehensive coverage. These Medicare supplements follow you wherever you go in the country. And then our next slide here, we want to talk about Medicare Part D prescription drug coverage. So these plans help to pay for your cost of medications. These are optional. You do not have to sign up for a Part D plan. But if you don't sign up for it when you're first eligible and you need it later, then Medicare is going to penalize you. There's about 28 different plans that are available in our state. There's quite a variance in premium, anywhere from $13.20 a month all the way up to $84 a month. The higher cost plans usually will not have a deductible. The lower cost plans will, and the standard deductible this year is $435. So in some of the plans that are available, that deductible is only applicable to Tier 3, 4, and 5 drugs, which means that that deductible you're not subject to if you're taking Tier 1 and Tier 2 drugs, which are the more affordable generic medications. Also, what you want to be aware of with Medicare Part D plans is most of these plans will have a large standard network where you can go just about to any pharmacy in your neighborhood, but most of them will have a preferred pharmacy network. And you always want to try to go to the preferred pharmacy network because that's where you're going to get the lowest copays. And now many of these companies also offer mail order pharmacy, and if you use their mail order pharmacy, many times they're going to save even more money because what they're doing is they're eliminating the middleman, the local pharmacy. And most of the insurance companies own their own mail order houses these days. So the next part of Medicare that we want to talk about is Part C, Medicare Advantage. Medicare Advantage is offered by private insurance companies, and we have many plans throughout the country where you can still get a plan for a zero monthly premium. Now the difference between coverage between a Medicare Advantage plan and a Medicare supplement is with the Medicare supplement is you pay a premium, but you get very comprehensive coverage with minimal or no copays. With Medicare Advantage, you can get a zero premium plan, but you're going to have copays for most every service. So when you go to see your primary care doctor, you might have a $10, $15, or $20 copay. When you go to see a specialist, you're going to pay a little bit more. It could be $30, $40, or $50. If you need a CAT scan or an MRI, it could cost you $250 or $275, or it could be a 20% copay. You end up in the hospital, and you could end up paying anywhere from $300, $400, $500 a day copay, usually with a maximum of about 5 days. Now, Medicare makes these Medicare Advantage plans use different models such as HMOs, which are health maintenance organizations, PPOs, preferred provider organizations, PFFS, which are private fee-for-service plans, and MSAs, medical savings accounts. And so you have these different options, and you have to remember that when you choose to go with a Medicare Advantage plan, you're swapping your original Medicare for that private insurance company that serves a local area, and they usually go by counties. And so when you're with a Medicare Advantage plan, Medicare requires them to offer at a minimum what original Medicare offers. But in addition to that, you're going to find that many of these plans will offer additional benefits in order to gain market share. Things such as preventive dental. Some even offer comprehensive dental, gym membership, over-the-counter benefit, rides to the doctor. They also pay for things such as vision, routine vision care, eyeglasses, hearing aids, routine hearing tests, One thing that we do know about these plans is that they change their benefits every year. Now, many plans offer 0 monthly premium, so we know that medical costs go up every year. How can a plan offer a 0 premium? And what they have to do is they have to decrease their benefits, usually by increasing the co-pays or the co-insurance. So originally we talked a little bit ago about Medicare supplements. With a Medicare supplement, you pay a monthly premium. And with a Medicare supplement, you have maybe a deductible and minimal or no co-pays. So very comprehensive coverage. Now with Medicare Advantage plans, many plans offer a 0 monthly premium, but you're going to have co-pays or co-insurance with that plan for just about every service. So for instance, if you go to a primary care doctor, you might have a $10, $15, or $20 copay. If you go to a specialist, then that specialist could charge you $30, $40, or $50, for example. If you need a CAT scan or an MRI, that could be $250 or $275. With some companies, it could be a 20% copay. So remember, with Medicare Advantage plans, you're going to have co-insurance for most every service, such as if you end up in the hospital, most plans charge anywhere from $300 up to $500 a day, usually put in a cap of 5 days on there. So with Medicare Advantage plans, they're available usually in major metropolitan areas. They're harder to find when you're in rural areas, and you have to live in the service area in order to participate in that plan. If you move away from that plan, you'll have to get another plan, what's available in the area that you move to. Some plans, such as preferred provider organizations, they will have deductibles. And preferred provider organization, you are allowed to go out of network if you want to see a specialist, but if you do, you might be subject to that deductible. And so with these Medicare Advantage plans, one nice feature about them is they do have an out-of-pocket maximum. That out-of-pocket maximum mandated by Medicare across the country is $6,700. So plans can offer a lower out-of-pocket maximum, but they cannot be higher than that. And that just means that if you got real sick one year, you're in and out of the hospital, you're seeing doctors, specialists, CAT scans, MRIs, and your co-pays were to hit $6,700, then it's capped, and the insurance company will pay for all costs above and beyond that. So let's review our coverage choices as a recap. If you want to stay on original Medicare, where you use that red, white, and blue card, then you will probably want to get a Medicare supplement, and that will follow you around wherever you go. With original Medicare, again, you can go to just about any hospital in the country. It's your choice. You have more control. If you want to see a specialist, you call up the specialist, you make the appointment, you go to see him, and Medicare will pay that claim. So you'd want to choose a Medicare supplement, and you'd probably want to get a prescription drug plan. The other avenue, or the other option that you have, is to go with a Medicare Advantage plan. And again, with a Medicare Advantage plan, they combine Part A, Part B, and Part D prescription drug benefits all together in one package, and then that private insurance company is now responsible for your Medicare benefits. Now, if you ever decide you want to change either a Part C plan or a Part D plan, that's why Medicare has Medicare Open Enrollment, which runs from October 15th through December 7th every year. So you can shop and compare these plans, and you can easily change from one plan to another. Thank you again for viewing our Welcome to Medicare presentation. I will be producing several more videos on subjects such as how to sign up for Part A and Part B at the Social Security website, and also more information on Part D prescription drug plans in the near future. So please feel free to check my website for these new videos. Now, if you would like a complimentary 1-hour appointment to review your Medicare options, please feel free to call me at 1-800-882-7828, or you can go to my website and request an appointment online at ronhouse.com. Thanks again for joining us, and have a great day.